Typically, we would make the diagnosis of epilepsy after a child has had a seizure. And then we performed an evaluation to determine whether there's actually a chronic risk for that seizure to recur. And usually that's done by doing a medical evaluation where we kind of do a history and delve into the seizure, the behavior that potentially occurred, and try to determine whether we think that this was a seizure or not. And then if our index of suspicion for that is high, then we then will proceed with a test called an electroencephalogram, also known as an EEG, which really looks at the brain electricity and allows us to look for abnormal activity that would say that there are higher risk for seizures to potentially recur. And if that test comes back abnormal and they've had a event that would be consistent with a seizure, we would then potentially make them with a diagnosis of epilepsy at that time. And that just means that you're someone who has a chronic risk or a chronic predisposition for having seizures in the future.